Hi there, I'm Dr. Jill Wener. I am a former hospitalist, internal medicine specialist, and I now specialize in teaching meditation and tapping and other stress reduction modalities to healthcare professionals and lots of other people. And I have been using this time pre-COVID, but also now during COVID, to help highlight some of the disparities that people are facing that have been highlighted and magnified by COVID, to bring attention for people to problems that were already there, that are not new, but that COVID is really raising the awareness of for a lot of folks. And so I'm here with Sarah Kleiner, who is a friend of mine. She's my meditation student, and she's a amazing person in her own right, without any of her associations to me. So I'm going to have her talk about herself, but she is here to talk about, she has an autistic child and how that has been affected by COVID, and what that looks like in the bigger picture as well. So Sarah, thank you so much for agreeing to be interviewed and chatting with me today. And if you could tell a little bit about who you are and what you do, and we'll start there.
Yeah, thank you so much for having me. Sarah Kleiner, and I am born and raised here in Atlanta. I have been teaching yoga for almost a decade now, which is hard to believe.
Wow.
But I got into yoga largely because I needed a way to manage my stress. My daughter, Alexis, will be 13 in December. She was diagnosed with autism right about 15 months. We kind of had suspicion a couple months before because she had a severe regression, basically lost all of her language, her skills, her eye contact, right about 13 months. And she has never regained speech. She'll be 13 in December. So we have had to learn kind of as we go to raise Alexis and give her the best life that is possible. And I have learned way more than I think I ever wanted to. But it's been this journey of, being a part of the world of special needs parenting, of autism, and then also having a career now as someone who teaches yoga. And I've, of course, found Jill in 2017, and I've been meditating every day since I took her course almost 2 full years ago, and that has significantly changed my life as well, and my ability to kind of handle and manage life as a person, a human being, which is hard enough, and also a special needs parent.
I remember you were saying, I mean, this interview really isn't about meditation, but you're like the example that I give of like the extreme ways that meditation can help with certain of your daughter's behavioral habits that used to just like,
oh yeah,
every time like re-traumatize you and set you off into a full fight or flight. And then after meditation, it didn't do that anymore. And it obviously, meditation doesn't change the facts of your life, but it can certainly change the way you react to it. So it's been, and I think you're studying now to become a meditation teacher yourself in our tradition, which is great. So, so it's been amazing to see what Alexis, I mean, underneath her autism, this veil, I guess, or she's brilliant, and you've discovered letterboarding with her, right? Like that's a way that she's been able to communicate. You want to talk a little bit about that?
Yeah. So it was when she was 9 that we were connected with some people, another family who had been to training to learn letterboarding, which is a type of facilitated communication. However, you hear facilitated communication and you think, okay, someone's moving their hand. No, these kids, and it's a lot of the kids that are non-speaking, they prefer not to be called nonverbal because they have everything up here, which she did. I had no idea. But it was another child who was non-speaking. The mother had been through training to learn letterboarding, and Alexis now has her own YouTube channel because she asked for one. She just hit 500 subscribers. I'm so proud of her.
Oh my gosh, that's
right?
awesome.
Yeah, I'm so excited for her. I'm working on another video right now, but she is brilliant, and she spells letter by letter her thoughts, writes poetry, writes stories, and just, it's beautiful. But I didn't know I knew, as a mother, like there's more to this child than what she's showing me. Like people were like, oh, she doesn't know her colors, she doesn't know her numbers, and they were making her do all these like really rudimentary tasks, and she was getting very frustrated, and she still gets very frustrated because she's still unable to speak. But we kind of unlocked her with the letter boards and have continued to do that. And not only does she know her colors, but she knows how to spell things like vermilion, which is a shade of red, which she requested some vermilion colored thread to make her necklaces with recently. And
Yeah,
I
I
never
mean,
taught her that. Like she just knew it.
yeah, and it's kind of crazy to think like all those years before that she was taking in everything.
Oh yeah, it
We
breaks your
talked
heart.
about
I
that.
mean, I still cry during letterboarding sometimes, but I cried probably every single session for a couple of years because I was so blown away with what she knew and thinking of how many situations she had been in where either I was talking about her like she wasn't in the room or
Mm,
someone else, her teachers, her school. I mean, it's like the amount of trauma she's been through of people just assuming she's not there and talking about her like she's not in the room her whole life.
yeah,
So it's been a big shift for everyone.
it's kind of mind blowing to even think about. So what goes into taking care of Alexis? What resources are involved in taking care of her? Where does she go normally during the day? What is schooling like for her? And what help do you and your husband have to take care of her
Well, I
and help her
consider us
thrive?
very fortunate because we have been tapped into resources since day one. It's my biggest resource is other parents. So other parents have helped me to get everything that we have for her. The first thing that we did when she was 3 and we started navigating the school system was hire an attorney, an educational attorney.
Mm,
And this attorney is also a special needs parent. And so she's navigated for years through what we had to navigate and has been gold to us. Some people thought I was being a little extreme to get an attorney, but when she was 3, the services that the school was offering us were just horrible. I mean, 15 minutes a week of speech in a group for a non-speaking child.
mm-hmm.
15 minutes a week of OT in a group. It was like, are you serious? And they want to send us across town to another school. It wasn't even our home school. So, fortunately, we had the resources to pay for an attorney, but we have used an attorney. Like I said, she'll be 13 now. I don't want to talk too in depth about what we've had to go through legally with the school system, but long story short, they were unable to give her an appropriate education. And we were able to prove that time and time again. So now she does have services with a private therapy group that's been amazing, that they've really taken her and, done a lot of wonderful things with her. And so she gets to go to that program year round. We don't do breaks. We don't take breaks because they're very, very difficult for her. But that's just the that's just the education piece. And we have to have had to modify our home because we worry about her leaving the house in the middle of the night or going, and she has poor impulse control, like eating all the food out of the refrigerator or the cabinets. We
Mm-hmm.
have an extensive lock and alarm system here at the home. Her bedroom has had to be extensively modified because of her sensory issues and because of her just, again, the impulse control and keeping her safe. Every situation we go into is like, a family vacation. You wouldn't believe what we go through to just take a vacation. We didn't go on
Right.
vacations for years, so it's like our whole life is different. Like there's an extra layer of like, okay, wait, we have to consider Alexis in the situation. Will she be safe? So it's a lot of, you mentioned fight flight. I think special needs parents spend a great deal of time in fight flight, and they live there. It just becomes normal to be in that overactivated nervous system constantly, you know in that state of panic.
It's the amount of detail and time and energy that goes into it just for day-to-day living is incredible. So what has life been like for you since COVID, since shelter in place started, or maybe a little before it was official? What does daily life look like for you, and how are you managing / are you managing to keep your sanity and to take care of her?
Yeah, again, I feel like we've been extremely fortunate to be connected to the support services that we have, because we have been able to get some help in the house using our Medicaid. Now, if you have a special needs child, you have to reapply for it every year. And it's basically like a stack of paperwork this big to have to go through and prove every single year that your child still has autism. They didn't just wake up one day
Wow.
and not have it. So you have to reprove it every year and give them extensive documentation, medical records, et cetera, et cetera. They have to be updated. But because we do have that, we've been able to get some services here at the home. So she's not been completely without. So that has been a godsend to all of us. But the first, I would say, 2 weeks, she cried 5-6 hours a day. I mean, no joke. And she's 112 pounds and 5'3", solid little lady. And she gets very physical when she has these tantrums. It's hard for me to pick her up. She gets aggressive. She'll scratch you. She'll try to hurt herself, put her head through windows, and like it gets very extreme. So we had like 2 weeks straight of that. No one was sleeping. It was very, very difficult. And, then we were able to start getting those people here to kind of help, to give her that daily structure again, which she really craves. She needs it.
So do you think it was the lack of the routine, like missing what is that the thing that set it all off?
I think, it's like the rug has been jerked out from under her completely. Like everything's gone.
Yeah.
Routine totally. And as I mentioned before, we have year-round school for her, because when
Okay.
she has longer than 1 week away from school, that's kind of her max. We can have up to like 3 months of repercussions from just the 1 week off. Like we've
Wow.
proved it time and time and time again. Like we have boxes of behavioral data that have been taken on her over the years to show, like, if you give her more than a week, you're going to have like 3 months of behavior to reckon with. So the like, boom, you're sheltering in place, everything's gone, no more school bus, no more school routine, no more friends, no more playground, like that was very, very traumatic for her.
I can't imagine. I want to say I can imagine, but I can't imagine. So the lack of routine just kind of upending everything. And how have you been handling your stress? How have you been doing?
Wow. Well, I have been meditating. Jill has taught me some advanced techniques for meditation, and really those first couple weeks, I work with another teacher, as Jill mentioned. I'm getting some training to become an initiator, and I kind of got permission from him to do rounding, which is an advanced meditation technique, up to 2 times per day, as long as I stayed in contact with him. So I had to really like space out that time to just go and do the rounding twice a day, because my body and my nervous system was so jacked up. I wasn't sleeping. My body was even swelling. I started having issues, like obviously my thyroid and my hormones were tanking, because I was just in that chronic state of like
Yeah.
flight, and I couldn't help her. I couldn't control anything. So I just did the best I could and just did that rounding twice a day.
So like supersized meditation helped you
Mhm.
survive a little bit. And an
Yeah.
initiator, for anyone listening, that just means a teacher in our tradition there, because you kind of have a ceremony that you do when you learn how to do this meditate in this tradition. So okay, so that's kind of gotten you through. What are your thoughts about other families who haven't had the access, who don't have the resources, who don't have parents who have the flexibility that you have? What have you seen, and what can be done to help support them, or what are some resources they can take advantage of?
Yeah, I have been in contact with several parents because I've run a group on Facebook. It's special needs parenting kind of support group, and I teach them yoga, meditation, just try to do some online stuff with them.
Mhm.
And definitely a lot of the parents there have been struggling. It's like the 2 weeks that we had have just been going on the whole time, because luckily we were able to use those resources, use our Medicaid to get those behavioral services in the home. And that's been a godsend. But a lot of them haven't been able to do that and don't necessarily have those resources. And so they've been incredibly stressed out. The kids have been very out of sorts. I've seen people getting sick, not necessarily with COVID, but just their immune system, like me. Like I said, in that first 2 weeks, my body was in this constant arousal, sympathetic state.
Mhm.
And that will wreck your immune system big time. And so, I mean, it's just kind of a devastation for these families to not have services for their children at all.
And I mean, without a educational attorney, is there a chance for people to get these resources? I mean, are there ways to access educational attorneys that are there services that like for free, or is it, and then what they do for you, are there other ways to get those resources?
Well, I mean, anyone can get Medicaid. You just have to go through the ringer. In Georgia here, it's called Katie Beckett waiver. I know there are Facebook groups where they will help you get the waiver, take you through the process. I had another parent that totally just walked me right through the whole process from start to finish, getting the application together. So I definitely recommend trying to get that waiver if you don't have it already. There's also a waiver called Now Comp that I'm working on right now because it's for kids as they get older, to get more of those assistance services at home. And so I'm going through that process right now, which is interesting. And I think, yeah, it's like I always say, the biggest resource is other parents. So there's Parent to Parent of Georgia is a good one because other parents are going to be your best resources. They're going to be able to give you those secrets and kind of like behind the scenes, like, okay, I know that this is what they say, but try this, or call this number instead of that one. So Parent to Parent of Georgia is a great resource here in Georgia, and I'm sure the other states have those as well. But just trying to hook up with some other parents, and the therapy center that we have worked with, they are still able to send therapists out to people's homes. So it's going to depend on the therapy center and if they've decided that these are still essential workers, the willingness of the therapist to go out to the home, it's just like it's so case by case at this
Yeah.
point. Yeah.
And do they give you special exercises to do in lieu of them being there when they're not, are they coming as often as they would, or is it more just like a limited time per day?
It's like as often as school right now.
Oh, good. Okay.
Yeah, I've
That's
been like
amazing.
so fortunate, so blessed because I've been able to continue teaching my students. I've set up a virtual yoga hub, so I'm able to teach now my students virtually. I have a corporate client, and now we're doing virtual yoga with them twice a week. And so I've been able to continue working, YouTubing, all that stuff, um, and not go not go crazy also. So stay
Yeah.
emotionally as well as I can be right now.
Yeah. Wow, that's a lot to take in. And I know, there's parents who are homeschooling their kids right now, or it's not even called homeschool. I mean, we're saying homeschool, but it's not. It's a totally different concept because,
Mhm.
there's lots of different, subtleties of that. And that's hard enough, and people are really struggling to manage their careers and their
Mhm.
kids and all this stuff. That's just like baseline kids without learning issues, without behavioral
Yeah.
issues, adding the complexities of and the safety issues that you go through, and fighting the legal issues. It's
Mhm.
just incredible to think about what it is that you have to go through. What are you looking forward to most about returning to life, for, from the perspective of Alexis and
Yeah.
caring for a child with autism, but also maybe just
Yeah. Well,
overall.
the letterboarding, we have three extremely gifted letterboarding therapists. One comes here, and then two of them go to her therapy center, and we haven't been able to see them in person. And I am still learning the letter boards. It's very nuanced. It's not just holding up a board and letting her go. Like there's a lot that goes into it. People that are trained therapists, they have to go through training for a year at least.
Oh,
And
okay.
it's supervised, so it's extremely complicated. So I can only get basic things from her on letterboarding. And so we are just dying we have a therapist, her name's Roxy, she's a doll. I just love her to death. But when Roxy comes over, it's like a family therapy session because we just talk about everything. And there's so many things I want more than like a yes or no answer, more than a basic answer. I want like an Alexis paragraph, I want an Alexis story to
Mm-hmm.
see like what's really going on here, because usually her answers shock me and surprise me. So that's a big thing that's missing right now from our life, is just that ability to have like a like a real serious conversation with her beyond like yes and no and like basic stuff. She can
Mm-hmm.
spell out a word and I can get that, but I really miss that. I think that's the thing I'm looking forward to the most, is just getting the letterboarding back regularly for her.
Okay. Okay. And is she someone, does she respond a lot to physical exercise? Is that an important part of her normal routine? And has that been limited by COVID, or is that not as much part of her
Not
therapy?
well, they have a gym at school that she loves, but we we pretty much have an adapted gym downstairs for her. So she's still able to. We've got like three different swings hanging from the ceiling.
Oh, wow.
Oh yeah, that's her gym down there. And then we've got a pretty decent sized backyard that she's been able to go out and play in. And we go on walks but she does miss going and playing on the playground and climbing. And they've got a climbing gym at her school, like a really extensive occupational therapy type of setup there. And I know that she does miss that quite a bit, as well as with being, we have an iPad and they try to do a virtual meeting with the other kids. And so it's really cute to watch her like look at the screen and like, see her friends. And so
Yeah.
I know she misses just being around the other kids for sure.
And it's such a gift for you to know that she gets what's going on. Like she understands that that's, cause probably before letterboarding, you didn't know if she was
Yeah, I didn't know.
able to understand
I would
what it all
do
meant.
my best they always say assume competency. And I think anyone with a special needs child, or as a teacher of a special needs child, a therapist, and you would be shocked to see how many people just don't assume competence. But that's what I've always tried to do. I haven't done it perfectly. As I mentioned earlier, there were times that I screwed up and I was like, oh man, I just said that in front of her, like she's not even here. But you have to just always assume competency of these children, because why wouldn't you, why would you? It's a whole it's a mindset.
I think back to my time practicing medicine, and you'd walk into a patient's room, and we had certain different, we had some patients with Down syndrome, and we had a lot of patients with cerebral palsy, and it's such a varied I'm forgetting the medical word for like how strong the disease
Yeah,
presents itself, the
yeah,
syndrome or whatever.
yeah,
And and I always, and like even patients with dementia, patients who've had strokes or nonverbal, I always would teach my teams and try as much as I could to talk to them as if I'm talking, even if they're not responding, even if they're not
yeah.
able to say anything, and the family's like, oh, they can't speak or whatever. And we walked into one room, and there was a woman who had severe cerebral palsy, and she was, I mean, like her poor little body was all like twisted and contorted. And we get in there and we're talking, and then she just opens her mouth and she's in her 40s, and she's just like mentally like 180% with it. She
Yeah.
was smarter than all of us. And I was so grateful that I had been taught that,
Mm-hmm.
because it would have been mortifying and so like um, insulting and all the bad things if we had not done that. And if you can
Yeah.
imagine what people were saying, and I know you told me that Alexis has had that experience, that she's heard people saying those things. So that's such a great way to do it, is to assume competency and just go through like that way. You are going to I think, always err.
Yeah.
That's all, that's always, you're not going to make mistakes that way. You're
Yeah.
definitely going to make mistakes the other way.
And I mean, now that we've got the letter boards, just in the last like 3 years where she's been where she's at, we've even there had a couple people who weren't presuming competence, but guess what? Now she has a letter board to call them out, which was, I never want anyone to lose their job, but there were a couple therapists that she, on the letter board said, these people are being bullies to me. They're talking about me like I'm not in the room. And they were removed from her case immediately.
Wow.
Yeah, the center that we work with, they took it very seriously, said, okay, we won't have these therapists working with her anymore. But I mean, I think of like, if she didn't have that communication tool to tell us, and she felt like these two therapists were bullying her and treating her unfairly, and just like, ugh, it breaks my heart to think about the kids who have to go through that and don't have a means to communicate it.
What percentage, I don't know if this is data that's known or that even if it is known, what percentage of non-speaking autistic children are actually like fully aware and fully intelligent and able to understand everything that's going on once it's determined? How many people are teachable for letterboarding? And does my question make sense?
Yeah, absolutely. It's hard for me to know those numbers exactly, but there seems to be a subset of kids who, like, autism is just such a broad term. If you've met one kid with autism, you've met one kid, like they're all
Right. Yeah.
different. But there's almost like a subset of kids that are just like my daughter, because there's a group of us here in Atlanta now. There's a support group, and there's a couple of schools now where they do it. But these kids, they are kind of like toddlers trapped in large bodies, like with their impulse control. And a lot of them express the same things of like, I didn't mean to do that, or they'll hit someone, or they'll bite someone, or they'll do something. And then later just, I'm so sorry, I lost control of my body. Like, I don't know what happened. Like my brain took off. And all of them are like that. Like all of them that I've met are like that are just like these gentle giants that just like lose control. And so I don't know. I've met one child who is a non-speaker, who the mother tried letterboarding and it didn't work out. She didn't take to it. I don't know all the details of like the therapist or any of that, but all the other kids that I've met that are like Alexis, getting them on the letterboard has been like, what? Like life-changing.
Yeah.
We recently did a math evaluation because she loves numbers, and she tested for calculus, like knew the quadratic formula. Yeah, I was like, what?
That's
Like,
amazing.
we filmed it because it was just unbelievable. But the woman who she runs a math program just for non-speaking kids. She's a math teacher at Paideia, and has been teaching like AP, high level math to all these Paideia kids, and discovered that these kids that do letterboarding, they love numbers. And it's like she's telling me the things that she teaches in 1 hour to these kids, like Alexis, it takes her a week to teach to her high school seniors at Paideia, that they just like, their brains just are like soaking it in.
Wow.
Yeah, it's absolutely fascinating. Yeah.
That's really cool. So tell us, thank you so much for sharing your story and your experiences during COVID and of course before, and also sharing some resources that other families could look into that may help them during this time. And I know there's so much, you're such an advocate and have been that since day one. And Alexis is so lucky to have you and all the things you've been able to accomplish for her. Tell us a little bit more about how people can find you, because you are not just a yoga teacher, you are also a YouTube celebrity. So
Love about that. I kind of by accident started this YouTube thing, which has been a blast. It's been a lot of fun. But I have an Instagram and a YouTube called Carnivore Yogi, where I've been doing a lot of interviews and just having a lot of fun on those two avenues. You can find me on Facebook. I have a group called Oxygen Mask Meditation, or OM, OMM, and it is a yoga meditation support group just for special needs parents. I'm posting stuff in there all the time. I'm just now starting to teach my yoga online. So if you go onto my Carnivore, it's at carnivore.yogi on Instagram. You can see all my links to practice live with me. It's like $5 a class if you guys want to take a class.
Awesome. And I'll get all those links from you and post them in
Yeah.
the description of the video so that people will be able to have that. Anything else? And I'll get some of those websites or some of the names of those organizations and Facebook groups for parents with special needs
Yeah.
children so they can access that as well.
Yeah.
All
I mean,
right.
it's the thing that I think is so important is the whole, like I said, oxygen mask meditation, putting the oxygen mask on yourself first. And, you know, I'm very fortunate that I have some resources right now where that's not like a big undertaking for me to take some time and meditate and breathe and do some stuff. But um, that's, I think, for everyone. It's so important that you take the time for me it's meditation. That's the thing. I also do some yoga, but just to find a way to rebalance your nervous system, so that you don't get sick, you know, so that you can be your best mom, parent, wife, all of the things. That's gotta be number one priority every day.
Absolutely. And I'll post links also to, I have online meditation courses that you can take. Sarah learned with me in person, but I also have online courses, which are great during the time of COVID. So that'll be at the bottom of all the show notes. All right. Well, Sarah, thank you so much for spending the time to talk about your experiences and share your expertise, and for being such a lovely person in general.
Thank you.
And I am really grateful for you.
Well, thank you. I'm grateful for you too.
All right. Thank you.
Thank you.